Hi viewers, I am Dr. Ruchira working at Eledent Dental Hospital. I am a dental surgeon. We have two branches, one in KPHP and the other one in Kondapur. Today I am going to discuss with you a very simple and a very basic topic that most of them will know very easily. This is called a filling or say tooth like filling. This is done usually when you have a decay in your tooth. So a tooth has three layers present, mainly A, B and C. To make it easier, I am mentioning it as A, B and C. When A is called the enamel, B is called the dentin and C is called the pulp. Okay. So when A is the layer that is visible to you, very much visible, the white present structure that is visible to you is the enamel. B is the dentin, which is not very visible, but sometimes when patients say they have a lot of sensitivity, that's when you can see a little bit of yellowish color structure present on the tooth, which is the dentin. Enamel is the first one, dentin is the second one. The third layer or the third is the most innermost part of the tooth is the pulp. Okay, so pulp is nothing but giving you blood supply, nerve supply and other relations to your tooth. Now when I say we do a filling, that is when you have a decay, when you have caries or something present around your tooth, we do a filling, and the filling is possible only if your decay is involving your enamel or involving your dentin. We cannot do a filling if it is going to involve your pulp. So that is when we will do only enamel or only in the dentin and filling. These fillings, we have three types of fillings, namely amalgam, GIC and composite. Amalgam is greyish in color and nowadays we don't really tend to use amalgam, so I am not going to speak much about amalgam. Next comes GIC and composite. GIC is a type of filling material. So when I am saying filling material, it means nothing but some type of cement which is used to fill in all the decay that is present in your tooth. GIC is nothing but white in color material which is filled in any areas that you tend to have decay. So now sometimes what happens is when you see this white color, people be like, why does this not look like my natural tooth? Did you take off my natural tooth? Did you grind off my natural tooth? And questions like that. And sometimes when people have a cavity in their front teeth, I cannot put GIC because it's going to be white in color and it's obviously going to be very visible. Whereas now if I'm going to speak about composite, my personal favorite filling material, of course when I say composite, it is a time taking process because the way to use it and the application of this is a little longer compared to your GIC cement. So when I am telling composite is purely tooth colored. So when supposingly you come and ask me that, madam, my tooth color is a little on the darker side or say little on the yellowish side, how are you going to fill it for me? It is just that depending on how your shade is or what the color of your tooth is, I will exactly place the same shade, because composite has different shades depending on the color or the shade of the patient's tooth, and that is how I will use this material to fill it. When also it is very useful because in your anterior teeth or say the teeth which are present in the front, you tend to have a small cavity, and when I fill this material, it will look exactly like your normal tooth and it will not cause any discomfort or any damage to anything surrounding it, no disadvantages, no sensitivity or nothing of that sort. The only difference is this is a little time taking compared to your normal GIC filling. But my personal recommendation is each time when you go for a filling, make sure you get something which is tooth colored. It is easy to use, it is easy to fill and very cosmetically, very beautifully it looks. So thank you so much. I hope you have liked the video. Please subscribe to our channel.